If you value serious historical knowledge that still has relevance today, subscribe to this channel now and share it with others who care about how real survival knowledge was forged under pressure. What you're about to hear is not romanticized history. It is practical, documented, and earned in blood. Roman battlefield medicine was not guesswork. It was a system refined through centuries of war, scarcity, and necessity, and, well, many of its principles remain useful to anyone studying survival, trauma care, or historical medicine. Why Roman battlefield medicine still matters to modern survivalists and historians. When the Roman legions marched, they carried more than weapons. They carried an expectation that wounded soldiers would be treated quickly, efficiently, and often with whatever materials were available nearby. The Romans understood something many modern people forget. Survival medicine is not about ideal tools, it is about functional tools. Their surgeons worked in tents, forts, and muddy fields, using materials that could be sourced, shaped, repaired, and replaced. That mindset is exactly why Roman battlefield medicine deserves attention from anyone serious about resilience and survival. Roman military medicine was institutionalized. Dedicated medici were attached to legions, and field hospitals known as valetudinaria were constructed even in frontier zones. Writers like Galen documented surgical techniques based on direct observation of trauma. These were not scholars speculating from libraries. These were practitioners dealing with shattered bones, deep lacerations, and infected wounds daily. How did common materials become precision surgical instruments? Well, Roman surgical tools were often made from bronze, iron, and occasionally silver. These metals, you see, were chosen not for luxury, but for availability and durability. Bronze resisted corrosion. Iron could be sharpened again and again, and silver had mild antimicrobial properties long before anyone understood bacteria. Now, what matters for modern readers isn't really the metal itself, but the principle behind it. Tools were shaped from materials already in the supply chain. Scalpels, for example, were simple blades fixed into handles of wood or bone. Forceps were forged by blacksmiths who normally made armor fittings. Needles for suturing were made from bronze wire, hammered thin and curved by hand. And if a needle bent or broke, another could be produced quickly. This is a critical lesson for survival context today. Function mattered more than refinement. If you understand the shape and purpose of a tool, you can recreate it from available materials. Treating battlefield wounds with limited resources was, honestly, a huge challenge. Roman surgeons prioritized stopping bleeding, preventing infection, and stabilizing the patient for transport. Deep cuts were cleaned with water, vinegar, or wine. Vinegar's acidity slowed bacterial growth, while wine acted as both a cleanser and a mild anesthetic. Wounds were probed using blunt instruments, often to locate arrowheads or bone fragments. The probing tool didn't need to be elegant. It just needed to be smooth, narrow, and controllable. For modern application, this really reinforces a key survival principle. In austere conditions, irrigation and cleanliness matter more than advanced drugs. Clean water, alcohol, or acidic solutions can dramatically reduce infection risk. The Romans lacked antibiotics, yet many soldiers survived grievous wounds because wounds were treated early and aggressively. Bone surgery and improvisation under pressure were common. Fractures happened a lot in Roman warfare, especially from blunt trauma. Surgeons used saws to amputate crushed limbs when gangrene threatened the patient's life. These saws weren't specialized medical devices in the modern sense. They were adapted versions of woodworking or metalworking saws, just refined to smaller sizes. Splints were made from wood, leather or bark, bound with cloth strips torn from tunics or bandages prepared in advance. This is directly applicable knowledge. If you understand immobilization rather than relying on commercial splints, you can stabilize injuries using almost any rigid material. Roman surgeons understood leverage, alignment and restraint long before X-rays existed. Pain management without modern anesthetics was, well, a real challenge. Pain control was crude but deliberate. Opium poppy extracts, mandrake and alcohol were used to dull pain and reduce shock. These substances were administered carefully, often mixed with wine. While dangerous by modern standards, they reflect a willingness to use botanical knowledge pragmatically. For historians and survivalists, the takeaway is not to replicate ancient drug use blindly, but to recognize the importance of calming the patient and reducing physiological stress. Even today, reassurance, warmth and controlled breathing can significantly improve outcomes in trauma situations. The Romans knew that panic killed as surely as infection. Hygiene, tool reuse, and the discipline of care were absolutely crucial. Roman surgical tools were cleaned and reused constantly. Fire was used for sterilization when possible, and metal instruments were wiped with vinegar or boiled. This routine discipline mattered. Infection was the greatest enemy on the battlefield, and Roman survival rates improved not through technology, but through consistency. In practical terms, this reinforces that any reusable tool must be cleaned thoroughly between uses. Survival medicine fails when hygiene is ignored. Roman surgeons treated cleanliness as a survival priority, not an afterthought. So, what can modern readers apply from Roman battlefield medicine? The enduring value of Roman battlefield medicine lies in its adaptability. Learn the purpose of tools rather than obsessing over their exact form. Understand wound priorities, bleeding, contamination, stability. Practice improvisation using common materials. Study anatomy deeply, as Roman surgeons did through direct experience, not abstraction. This knowledge is not theoretical. It is earned through repetition, discipline, and respect for physical reality. Roman battlefield medicine was brutal, efficient, and effective because it had to be. If this kind of grounded, historically accurate survival knowledge matters to you, subscribe to this channel, share it with fellow historians and survivalists, and keep this legacy alive. Real history is not entertainment. It is instruction written by people who lived or died by what they knew.